Everyone, welcome to the 11th in this webinar series of the CQUIN HIV Learning Network. This webinar series is brought to you by ICAP at Columbia University, colleagues of the International Treatment Preparedness Coalition, as well as the Differentiated Service Delivery Initiative of the IAS. My name is Dr. Anna Grimsrud, and on behalf of the IAS DSD initiative, we're really excited to have you join us today, whether it's morning, noon, or night for you, to talk about DSD, the supply chain and COVID-19, what to expect and how to be prepared. For those of you who are joining for the first time, you will be in the attendee room. And for those of you who have joined us before, we would welcome you, as always, to introduce yourself in the chat box. Please select all panelists and attendees and let us know where you're from. And if you would like to join the WhatsApp group, please feel free to send us your mobile number. If you have questions at any stage during the webinar, please put them into the Q&A, and we will make sure that those are answered by the panelists and discussants. I'm just going to pause for a brief moment. I can see that some of our colleagues from the Global Fund have joined, and just make sure that their audio is nice and clear. So good afternoon, Martin. Do you want to unmute yourself and just say hello to everyone?
Hello, afternoon. So this is Roger Lee from the Global Fund, and Martin's unfortunately not joining us. So
no problem.
Roger's
well,
here.
Thank you very much, Roger Lee. Thanks for joining us. I'm going to turn over to you shortly. I just have a few other slides. So again, welcome everyone. So as many of you know, this webinar series has been going on since the last week of March. Today, we are very happy to be able to bring you a live translation version into French for those of you who require it. And so please, if you would like to hear the French version of this webinar, attendees, you can find the interpretation globe on the menu of your screen, and you can select the language of your choice. Today, the presentations are going to be in English, but there will be simultaneous French interpretation. And if you have any issues, please feel free to write to Laura Block directly, and she will try and help sort you out. I also just want to flag that webinars from other Tuesdays in the series can be found online on the CQUIN website, where you can access both slides and audio recordings of previous webinars. And please also feel free to block off this slot for the next 2 weeks, where we have additional webinars forthcoming. So in terms of housekeeping, just to restate some of our rules here in this webinar series, we really do want to answer your questions, and we are really happy with hearing from all of you as attendees. So please feel free to ask questions anytime in the Q&A, and then this gives everyone an opportunity to see the answers. You can use the chat to introduce yourselves, and you'll note that you're muted if you're in the attendee room. Also, I've gone through how to access the translation. If you would like to hear the simultaneous live French translation, please go to the interpretation globe in the menu of your screen. And then finally, today, we would also like to try some polls to kind of gauge your opinion and gauge your perception of what's going on in your country regarding supply chain. And so please note that these are going to pop up on your screen. So in order to kind of test that, we're going to run the first poll now and hope that this works. So the first poll question today is to see if you agree with this statement. So the question is, how much do you agree with this statement? And the statement is, the supply chain of antiretroviral therapy in my country is a challenge. I'm sorry, panelists, you are not able to answer. This is only for the attendees. And so we're going to give them a moment here to answer this question. Their options are strongly agree, agree, neutral, disagree, or strongly disagree. And we're going to leave this poll open for the next few minutes and see what you as attendees have to say about the supply chain in your country. So today, we really thought it was important to highlight supply chain challenges and to look across the supply chain. So we want to really try and be specific about where within this supply chain we're discussing challenges. Are we talking about it at the level of API production? Are we talking about it at the level of manufacturing? Or are we looking at the logistics or in-country supply chain? We also have asked the speakers and panelists today to share their knowledge on what was challenges before COVID-19, what challenges have been exacerbated by COVID-19, and what challenges have been caused by COVID-19. Because as you are all well aware, supply chain challenges are not something that are necessarily new to the countries and contexts in which we work. We have a really exciting lineup today in a slightly different format than to the other webinars in this series. So I'm going to hand over to Roger Lee from the Global Fund, and he's going to give us a keynote presentation updating us on the health product supply chain, including on antiretroviral therapy. And he has some slides that he'll be sharing with us. After that, we're going to have a panel of perspectives, and we're going to shift entirely to not having a slide-heavy presentation, but hearing from Jessica Burry, a pharmacist at the MSF Access Campaign, from Lillian Moreco, the Executive Director of the International Community of Women Living with HIV in Eastern Africa, and to Diana Edgill, who is the Head of Supply Chain for Health Division at USAID. I also just want to thank everybody for joining us today in your various time zones. And a special shout out both to Lillian and her colleagues in Uganda who are joining us today, because it's actually a public holiday in Uganda. And I believe the public holiday today is National Heroes Day, which makes me even more honored to have Lillian join us today, because you are truly a hero in the response. So thanks for making this part of your holiday today, Lillian. And then finally, we're going to move to the Q&A and wrap up. So as mentioned, at any stage today, please do put your questions regarding supply chain, COVID, and DSD into the Q&A, and we can have responses from our panelists and presenters. So just quickly wanting to ask Laura, you can end the poll and see the spread of results across that you all shared in poll 1 in regards to how the supply chain and whether or not it's a challenge. A third of you strongly agreed, and another third of you agreed. And so I would say that this is something that's highly relevant, and we expect that given that you're the ones that joined today. A few of you were neutral, and 22% of you disagreed or strongly disagreed that the supply chain was a challenge. So wait, and you will hopefully be able to engage in more of the polls during the webinar today. So now I would like to turn over to our keynote presenter, Roger Lin from the Global Fund, to give his presentation. Thanks very much, and go ahead, I will advance slides for you.
Thanks so much. Good morning, good afternoon to everyone. So as we are in the global pandemic, I hope everyone are safe and your family are safe as well. So today I just want to talk to you some kind of a high-level thinking about how the Global Fund adapt some of the practice to respond to this health product supply in the situation of the COVID-19. Next slide, please. So the root of thinking is really fall into potentially 6 pillars. So we assess or we conduct a supply chain risk assessment. We'll go to the upstreams, not only looking at the direct supply, not only looking at direct product supply, looking at the upstream supply, looking at the API supply, looking at the packaging supply, looking at the excipient supply, looking at potentially even the fine chemical supplies, so, and really have a better understanding in which step of supply chain has impact or likely to be impacted by the COVID-19. And then we start move on to next pillar to actually estimate. So what's the risk? So what's the impact? What it means to us? And then we start looking at how we can potentially kind of avoid or mitigate such risks. And then when we have done all this analysis, we start thinking broadly about, we are in the partnership environment. We're in the public health. We fight against the malaria, HIV, and TBs. So what are the partnership relationship we can leverage to help us together? And the close collaboration will help us be strong and help us to manage the situations. And then we now what you see here on we publish a lot of things. The communication in such a situation is very, very critical. Enable us to communicate the key issues, key constraints to the countries, to the PR, to the people who concern the most, and then invite their feedback as well. In the same time, the last pillars, the 6th pillar, is actually really to adapt our internal, more rigorous processes to control the risks. So here's an example, basically, the point I'm trying to make on the communication. In the public domain, we actually share a lot of information about our assessment, about our recommendation, about how we can procure the COVID-related commodities through the Global Fund. So if we zoom in one of the assessment, if we move to the next slide, please. Where you can see, the detailed assessments available online for you to read, and also we share the high-level risk, let's say, ratings for health products. As we see today, as you indicated already in the survey, you believe the let's say in general the pharmaceutical supply is kind of at a medium risks, or for someone for you is high risks. Based on our assessment, the current and the pharmaceutical supply is at a medium risks, primarily because in the early years, let's say in the Q1 2020, we see the things evolve very quickly in China, which has impact on the fine chemical intermediates and API supply at the time, which have impact on April productions onwards in India. In the same time, from late April, early May, the lockdown in India also have impact on the overall supply of the finished products. But all in all, what we see today, the risk associated with the pharmaceutical productions and supply is largely driven by the freight logistics, meaning the logistic from the raw material supply from the origin country to the production countries, and then move the product from the supply origin countries to the recipient countries, which in these kind of steps, each step have a couple of weeks delayed because of the availability of the logistics, because of the availability of the vessels, right? And also many of the as we speak, our forecast doesn't necessarily to be really perfect in many ways. A lot of raw material end up shipped by the air shipments. Now, as you know, most impacted is actually air shipments. Very limited cargo planes available nowadays. So same methodology we review on BATNet. The same I would say the same assessment has been or conclusion has been concluded, right? So essentially, there was a hiccup on the raw material supply. There was a hiccup because of lockdown in countries. Therefore, we face sometime there is an interruption on the productions, and as we see today, primarily the production is all resuming, and then again is sometimes is still the hiccup about how many to what extent we have the full workforce is back in the production. That's why we still believe the BATNet is still at the medium risks. On diagnostics, and here we rate as a moderate, is essentially because the issues emerging on some of the rapid tests supply. And then, as you know, we are in a pandemic, and we move very quickly on the molecular-based technology first, and also we move into the rapid tests. So therefore, the industry response to that is there's to some level there's capacity constraints. There are also certain level of prioritizations at the manufacturer side also take place, where they would like to produce more COVID RDT rather than the normal RDTs, etc., have impact on the overall supply as such. Therefore, we believe the current risk is on the moderate high, and certainly working with the partner to try to address that. I think I already covered on the freight logistics. Just summarize that again. I think as of today, let's say the ocean freight is still the most reliable freight mode. The air freight seems to be really problematic. Down the bottom, we also have a risk assessment about the current PPE supply and also COVID-related diagnostic supply. I guess for you all, won't be really surprised. So the diagnostic supply is really primarily driven by the availability of the capacity or availability of the possible allocation to the low-income countries versus high and middle-income countries. And also PPEs, very well, because different standard and different quality requirement, and more importantly, because of the really the large demand all of a sudden really drive this upstream supply chain very, very challenging situations. But I believe that this situation also will recover very quickly. So all this information actually available on the Global Fund website. If you will, you can free to download, have a look on that. Then we can move to the next page. We cover about the issues we address on the supply side of things. We also talk about how we can work with the partners, and we also taking initiative of working with PRs as well, right? The challenge with basically the thinking of that is trying to get a better visibility of the demand. So at the time we ask the PRs come in with all their demands before April 10th in order to have better visibility of the in 2020 remaining months delivery plans. We also update the policies to accommodate the situation in case any delays, because it's the grant closure year for the Global Fund. Everything is supposed to be delivered by the end of 2020. Now there are policy support certain delays in 2021, and also we provide the track and trees and supporting tools for the PR to have a better visibility about where are the products. That's essentially how we really, again, enhance the communication with the PRs, enhance the communication to invite the feedback, to understand better the demand, and also enable us to better manage the supply situation in a very difficult situation. I think that's the end of my my speech on the Global Fund side. Over to you. Thank you.
Thanks very much, Roger. I just want to check that you're going to be able to stay with us for the rest of the hour. Is that right?
Yeah, well.
Excellent. So just to say that was a really, really excellent overview of all of the work that I'm sure is happening at the Global Fund. And as you know, we will share these slides, but as Roger alluded to, there are more details available through these hyperlinks on the Global Fund website. And also these are regularly updated as situations change and as new information is available. I would like to make sure that people know they can ask questions of Roger in the Q&A and direct you to do that. Now, without further ado, I want to put up our next poll to hear from you all in the audience, all the attendees, to see what do you think in terms of supply chain challenges? Do you think that your country is experiencing supply chain challenges because of COVID-19? Yes, no, or I don't know. And we're going to leave that poll running for the next little while and move over to our panel discussion, our panel of perspectives today. So we have 3 panelists who have graciously joined us on the call and who have also sent in their some snippets of their perspectives to help us guide this conversation today. So I would like them all to unmute themselves, and I give them each a moment to introduce themselves and say what perspectives they'll be bringing to the discussion this afternoon. So first, go ahead, Jess, and introduce yourself to the webinar audience.
Great, thanks. Thanks for the invite and nice to join you all. I'm Jessica Burry. I'm based in Geneva with MSF with the Access Campaign, and I'm a pharmacist focusing on HIV and hepatitis C. And so I'll try to give a bit of the perspective from what we've seen from the MSF angle and some of the topics that we've been following more globally in terms of the supply chain. Thank you.
Excellent. And Lillian Moreko, would you please go ahead and introduce yourself?
Hi, my name is Lillian Moreko. I work with the International Community of Women Living with HIV based in Uganda, and I'll be bringing the perspective of recipients of care. We work with women and people living with HIV, and so what I'll be sharing is related to the experience of people living with HIV during this era of COVID, but also prior. Over to you.
Great. And Diana, would you like to unmute yourself and introduce yourself, please?
Sure. Good morning, good afternoon, everyone. I'm Diana Edgell. I'm with USAID in the Office of HIV/AIDS. I'm the chief of the supply chain division there. So I guess that the perspective that I'll be bringing is somewhat similar to Roger's in that our division manages USAID's supply chain contract for HIV commodities. So we've been looking at the same things, the same constraints, and having the same conversations about supply chain for HIV. We're also running the supply chain for COVID commodities at this point through USAID. But I think the perspective that I'd like to bring to the table is one of, finding a silver lining in the challenges that we are encountering with COVID. I think that some of those challenges have allowed us to think differently about how we provide a service to clients, to HIV positive clients. And I think that it would be helpful for us to have conversations about how we can just focus in on that percentage of individuals in normal time who are potentially not receiving service because of either isolation, stigma, or self-removal from the system, and how COVID helps us to think about what things we can do for that population and continue to carry them on once the COVID epidemic is over.
Excellent. So I'm going to go through 5 questions with you this afternoon. So the first one was, what was the biggest supply chain challenge pre-COVID? And some of the responses that you sent in were as follows. So the 3 of you spoke about how there were ARV stockouts due to poor drug ordering and inaccurate quantification, how there was sometimes data availability was a challenge and didn't allow for real-time assessments. Shortages regarding personnel who specialized in supply chain, weak storage capacity, and other challenges such as the national supply chain suppliers being delayed due to their tendency towards bureaucratic decision-making, and some specific drug challenges that were raised by one of you. So to any of the 3 of you, is there something that you think really was a challenge before COVID and is now persisted? Which of these topics would you like us to start on?
Well, this is Diana. And I'll own that I put data availability out there, and my feeling is that at least some of the issues that were identified by all of the panelists are related to a lack of true transparency within the supply chain. ARV stockouts due to poor ordering and inaccurate quantification is a direct result of a lack of data visibility all the way down to the service delivery point. And despite the existence of logistics management information systems and ELMIS, we're still not looking at data in a fluid way, in a way that allows us in real time to understand what's being used, what needs to be replaced, and what the trends are at a particular site. And that then backs up all the way to the central level, and then the bureaucratic tendencies and the delays and the tendering processes, often just in countries which take quite a long time in some cases, then result in stockouts. They result in sometimes emergency orders having to be placed. So from my perspective, quite a lot of the problems that we see within the supply chain are due to a lack of data flow, and might in fact be resolved if we did have access to that data throughout the supply chain. In fact, if we did have access to that data, I think that we could ask manufacturers to do more within countries, to invest more within countries within the supply chain, that would then allow us to step back a bit and to allow those manufacturers to, in the same way that they do in many countries in the United States where I am, where essentially the manufacturers have contracted the supply chain out to the private sector to allow for both economic investment in the system, but also to allow for better control of the supply chain in general.
And just picking up on that, over to either Jessica or Lillian, do you think that some of these challenges regarding data availability have been, how do you think those have changed recently? Do you think that COVID has exacerbated them or highlighted them? Have you heard anything on that?
Hi, Lillian here. So thank you very much. So with the COVID-19, I think the issue of stockouts has been a glaring issue, especially from the recipients of care, or people who are receiving services. And this has been mainly one, especially for countries that have been under lockdown. This was not something that was anticipated. And as a result, we find that there wasn't enough stock in facilities, and it was a challenging period even for people who were locked down, including services providers, implementing partners. We guess that it was a challenge for them to get to demand for stocks. Can you hear me?
I can hear you. It's intermittently, and I think that's the same for everyone. But you were picking up on the impact of lockdown on supply chain, Lillian, is that correct?
Yes, yes. So what happened is that for majority of our people, for example, they were not able to get the products that they needed. For example, the people who were taking Aruvia at some point, they were really drug stockouts, and they were changed. And first of all, they did not understand why that was happening, but also it was not easy for them to get the information that they needed to make sure that they were able to take the products that they were being started on. So just to say that it is true that the question of stockouts of ARVs has been an issue, and there has been a lot of conversation amongst our own groups in terms of how do we support each other, and it's been really an issue that we can continuously talk about. I strongly feel that, yeah.
Yeah, so just picking up on that, you were mentioning specific regimens and how there's been supply chain challenges that predated COVID. I know that the next question we have here is around the biggest supply chain because of COVID. And just to note that 3/4 of you said that there are challenges because of COVID in terms of the results from the poll. And maybe I'll give Jess the first point here to say, I'd kind of mapped out here that many of you had mentioned something related to lockdowns or restrictions on movement that had a knock-on effect to the supply chain. Jess, I don't know if there was something you could pick up on from this slide.
Yeah, sure. So I think the biggest supply chain challenge is because of COVID. It's a bit what Roger was saying earlier, that we've seen the short term, and I think we will see the long term concerns related, and that we've already seen, delays by a month or more for orders that are leaving India and going to various countries around the world. And that's for a bunch of different reasons, from lockdowns that vary by country, and in India, where the majority of our supply is coming from, and I mean the global supply of generic ARVs, we've seen the shutdowns that cause people just can't get to work, or you don't have people to process the paperwork to be able to export. Transportation is not there, the flights are not there. So a lot of those are relating to the short term that so far it seems has been more or less managed, but there's still the potential that in the longer term or in the medium term we can still see some difficulties. We know at the beginning of the lockdown in India, the manufacturing companies were producing only at 30 to 40% capacity. Then they were able to increase to 60 to 70%, and now as of end of May, it's the end of the shutdown in India, hopefully. And so hopefully we'll see that they'll be able to recover, and that the impact won't be so great. But that fear is certainly still there. And then we see in the bigger picture the whole discussion around our key starting materials, our active pharmaceutical ingredients. They come mainly from China, whereas the tablets and the vials and the final products, they're coming from India. And so we're, as a global community, we're completely dependent on a couple of countries. And so how will that change or improve or be modified in the longer term to bring more supply security? Because so far it seems that there's been some shortages and been some stockouts, but the potential that it could have been much worse, I think is there. And so it brings up a lot of different challenges that we need to address.
Thanks very much. And you'll note that I moved the slide ahead just to speak to your second point about the long term. It's maybe not on here directly, but something that I've definitely been interested in, and maybe Diana, you could speak to this, would be, we know that there is obviously a long tail effect, or things that happen now will have an impact in a few months' time. What sort of time period should we be looking for to see when these interruptions or disruptions will be? How long in the future do we anticipate that something that happened today will have an impact on supply chain?
I think it probably depends specifically on which aspect of supply chain we're talking about. So if we're talking about ART and the reduction in manufacturing capacity, the expectation is that we will start to see problems sometime in the August and September time period. Part of the reason for that is that that in addition to just shortages in general and long transport times and long lead times, is also that I think most countries have been moving toward distributing multiple months of stock, which is great, right? That's exactly what we want to happen during a COVID epidemic. We don't want people to have to go every month to a clinic, to a crowded clinic, and expose themselves to COVID. And so, we're doing what we need to do in order to push program in the right direction. What that also means, though, is that quite a lot of the stock has been flushed all the way down to the end delivery point, the service delivery point. And so there is not a whole lot of stock left at central medical stores. And when there is a delay in delivery of the rest of the stock, the backfill, basically for your pipeline, at some point in the August and September time period, we expect that there are going to be countries that begin to stock out, and that we will be struggling to get product to those countries at the time that they need them for the next round of distribution. I would also say, though, that there are other issues associated with COVID that have been a problem for us. There's been a lack of PPE, which has prohibited some of our healthcare workers from operating in this space. It has resulted in, at least for us, an inability to transport, or a restricted ability, maybe I should say, to transport product across borders. In Africa, at least, we rely somewhat heavily on ground transport, and lockdowns that do not allow us to drive across particular countries or to make deliveries from South Africa into other countries can really restrict supply chain. So we've been working through this. I would also say that the lockdowns at ports, and there are many ports that have been locked down, and for which we have product that is really just sitting either at the airport or on a ship, waiting for entry with an extreme delay in uptake. Landlocked countries, again, with borders that are closed, or borders around them that are closed, are particularly difficult. And so for those countries, we really are trying to figure out how to charter flights to get into, for example, Zambia. So I will say that most of these restrictions are problematic. We've also had, with a lack of PPE, we've had some of our drivers pulled over and told that unless they have a face covering, or unless they have some sort of mask, that they are not allowed to drive from one place to another. So the restrictions, I think, are ones that we're all familiar with, but they're resulting in workers being unable to carry out their jobs. And so, I think we struggle on a day-to-day basis with how to make sure that we are nimble and that we have equipped supply chain workers with what they need in order to do their jobs.
Thanks, absolutely. Lillian, I can see you're unmuted, and a lot of the answers that you gave had an angle related to integration from the recipients of care perspective. I wondered if you could speak a little bit to what you mean by integration around some of our supply chain challenges.
Yeah, thank you very much. So the point here is that the supply chain can only be completed if it addresses the needs and priorities of an individual as a whole. But what we are seeing is that, for example, where countries have managed to complete the supply chain of antiretroviral drugs, there has been other issues that are missing out in that. For example, sexual reproductive health and rights needs of women and girls. We are hearing countries reporting lots of anti-pregnancies amongst adolescent girls and young women. We are also hearing a lot of reports around gender-based violence, and services to that effect have not been integrated. But we are also receiving reports of situations that people are getting into where people are having mental health issues and problems, just because counseling is not part of especially in countries where the lockdown, like Uganda, is happening. Those are some of the things that are not included in the program that is being delivered. And therefore, the supply chain has sort of missed out on those key critical areas that would make the services coming and beneficial to the recipients of care or people that they are intended to. And I think the other point that is important to raise here is the fact that, again, from our perspective, the supply chain can only be complete if the intended beneficiaries or recipients are able to get services without any challenges and hindrances. But what we are seeing now is that because all of us are trying to make sure that services are not interrupted, we are using different means and ways of making sure that we reach out to the people in their homes, in their communities. And in doing that, we are sort of making it hard, especially from the perspective of human rights. There are issues of stigma and discrimination that are associated with that. We are seeing situations where we are beginning to disclose people's status because we need them to get services, and that makes the supply chain get a challenge in the way that majority of people are saying, we don't want you to get closer to us. Yes, we understand we need these services, but my rights take priority. The community I'm living in does not understand the issues of HIV, and therefore I'm going to be facing lots of stigma and discrimination, and therefore it is better that I have access to therapies now rather than being stigmatized. And this also relates to what communities are experiencing, especially as a result of COVID-19, that levels of stigma and discrimination are seemingly getting to be real, and therefore people who are, for example, communities of people living with HIV are like, I don't want to probably go through what I'm seeing and how I see people, and therefore it's better not to have access to these services. So those are some of the challenges that are critical to the supply chain, and that even when probably we have the products available, they may not be accessed and available and used by everybody who needs them. Over to you.
Mm-hmm. Mm-hmm. Excellent. Thank you very much, Lillian. So as I mentioned, the last supply chain webinar we had in this series, I believe, was on the 7th of April. So a little bit more than 6 weeks ago now. But I asked all of you what you think has changed the most in the past 6 weeks. And there was a lot of diversity in your responses to this. So I wanted to just open it up to the three of you and ask, what are you talking about now that you weren't talking about 6 weeks ago? And also, Roger, just to flag, there's some great questions coming in the Q&A if you have a chance to type some responses to them or anyone else who's in the panelist room. So not sure who would like to go first, but what has changed the most in the last 6 weeks? Maybe something that you think has positively changed?
It's Jessica, I can start. Yeah, I think a lot of our concerns that have, or things that have changed in the past 6 weeks reflect some of the challenges we've discussed in terms of, logistics and transport, and increased engagement with the companies, more monitoring to ensure that we'll be able to have supply available, having our colleagues in different countries also engaging there to find out, what's going on at the Ministry of Health level, and how we can support and maybe try and have more supply in country. I think on the positive side, there's certainly more collaboration, seeing between different organizations that are sharing information to try and support. I've seen a lot of cases in India where there's been a lot of effort to, get charter flights and organize between different organizations going to the same countries. So I think there's certainly a silver lining on the cloud, as Diana said earlier, despite all the difficulties. And probably the last thing is to say we've certainly had the same problems of PPE. That's been our biggest headache and the biggest hot topic across MSF for the past couple of months. Thanks.
I totally agree.
Yeah.
Yeah, I totally agree. I think that that the silver lining, or not maybe the silver lining, but the positive change or development has been the amount of collaboration and communication that has begun or expanded over the past 6 weeks. I think there have been even periods where, for example, we've been unable to access cold chain transport for diagnostics, and we're talking with UNICEF about how to potentially use a flight that they have already chartered that could take both their products and our products in. This is something that we never would have done in the past, but it is not necessarily something that we shouldn't continue to think about in the future. It is, of course, difficult to coordinate two different agencies' orders and ensure that they can ship together. But it's not unreasonable to think that if we and another agency have products that are coming out of the same manufacturer and going to the same country, that we shouldn't be able to think of a way to leverage one airplane or ship to get that product into country. So I think that we're all in this together, and it seems as though everyone is really open to making things work in whatever way we have to get product into country. On the downside, of course, the stocks continue to decrease, and we're just watching the days tick by without deliveries, so I think that's panic-inducing, certainly.
I can hear it in your voice.
Right.
Lillian, I see you're unmuted. Did you want to add something here?
Yeah, I just wanted to add to say that I think what we have seen in the past 6 weeks is the fact that there has been a lot of collaboration and partnership between implementing partners, service providers, and the recipients of care in terms of ensuring that delivery of services is a joint venture. But I think also we are seeing that countries are beginning to ease the lockdown, and there's quite a lot in terms of what is needed, especially for the vulnerable groups and communities that are going to continuously live in this challenging world of COVID-19 in terms of personal protection, especially for people living with HIV. And so we are seeing that as in terms of everybody must be cautious, must protect themselves. But I think what we haven't seen is how we match that core to make sure that the services that are being provided are taking into consideration the current needs and priorities of the vulnerable groups, especially people living with HIV, if they have to survive COVID-19. Over to you.
Thank you. So then to the audience here, we're wondering, is your country experiencing shortages of these ARVs? So we've got a third poll that we're going to put up and leave up while we move to another question with our panelists. And don't worry, I've given you an I don't know way out so that you can still participate. So many many responses came in from the three of you in terms of how countries should prepare. And I think this also reflects that many countries are trying to prepare and forecast in terms of ensuring a robust supply chain. And so I just kind of mapped out some of the words that were mentioned a lot, and you've brought up a number of them again, Lillian, in terms of coordination, working with communities, ensuring that there's strategies in place to strengthen the supply chain. And so just to any of the three of you, was there anything else that you really wanted the audience today to take home as a key point in terms of preparation and what they should do to try and ensure that there aren't interruptions in their supply chain?
Yeah, again, I think, and it's maybe perhaps just not just data, but communication. So one of the struggles that we find within the supply chain is that the service delivery point may not know who they are supposed to call when they stock out of something. You know, it's happened multiple times where you know, I've gone into a site, found that something is stocked out or about to stock out, and asked, well, has an order been placed in the system? And been told, no, actually an order hasn't been placed in the system. And of course, you know, that's exactly what you want to do. If you have only a week's worth of supply left, then we want to make sure that the central supply chain has an understanding of that. So really, you know, I think now is the time for us to be very clear about how to communicate back into your country's supply chain the need for restocking. Things are much slower at this point, and that data may ultimately be aggregated for a higher level order. It may be that, you know, that consumption has increased, or that, you know, consumption has changed at some pace that needs to be understood within the supply chain in order to ensure continuous supply. So I would at this point say communication is key. If there are, you know, if you are stocking out at your particular clinic, but a clinic that is, you know, a few kilometers away still has stock, usually supply chains know how to redistribute stock. And that might be one of the ways in which we all help each other to continue. So, you know, at this point, I would just say communication.
Great, and then I'm going to move along to the last question, because I want to get to some of the Q&A, and say, I asked you guys all what keeps you up at night regarding supply chain, and really some of you are getting quite interrupted sleep given all of the answers that you provided. But I thought that I just wanted to pick up on a few, and Lillian, you're unmuted, so maybe you could comment on this first. But some of the answers that we heard were that the consequences of shutdowns in countries like India and China are keeping you awake, that there are shortages of necessary commodities and limitations on manufacturing capacity, and that you anticipate that there will be stockouts, and that is something also that's interrupting your sleep. So Lillian, did you want to make some closing comments here?
Yes, I think as a person living with HIV, of course, it is something that bothers us to the extent that we know that, for example, where we are seated, or our products come from countries like China, like India, we are getting worried that with this kind of shutdown and long shutdowns, but also closure of entry points, especially to countries that are landlocked like ours, we are not so sure, especially well knowing that even previously we had drug stockouts, so we don't know what this means for our future. It is also important to note that we are also worried to the extent that there's going to be divided attention, there's already divided attention, there's already divided resources, and therefore the question of whether countries will continue to, even those that are manufacturing ARVs, for example, and will continue to do so, is another question that keeps us awake, that we are not so sure that we are all getting taken up by COVID-19, even in terms of research, in terms of, you know, so it is something that it's really worrying for people living with HIV. But it is also worrying us that to the extent that, for example, when you talk about regions, when you talk about, we don't seem to see the integration and cross-border collaboration and partnerships working at this moment. And therefore, if it is not working, especially around COVID-19, it worries us that it may be the same for HIV and other services like sexual reproductive health and rights services. And therefore, that is the biggest challenge for people living with HIV. We don't know the future. We don't see how the future, especially from the supply chain, is going to be, and therefore that is one of the biggest ones. Over to you.
Thanks very much, Lillian. Thanks so much. Jess?
Sure. Yeah, I think some of our concerns are similar in terms of, you know, what's going to happen with supply and potential for stockouts. And it was super important to be able to, you know, dispense more drugs to patients to avoid that they will come to clinic. But at the same time, are we going to see the consequences of that later? And could we find other ways to support people to avoid coming to clinics? And the other thing that I worry quite a bit about, and this is part of my other work in addition to HIV, is looking at the commodities for COVID-related illness. And so if we step back and look at the bigger picture and access to medicines, we know that, you know, low and middle income countries are often last to get new medicines as they come to markets. And so we're seeing every day new announcements about collaborations and a lot of money, billions of dollars being put on the table. And we don't see any restrictions and requirements to say that, you know, that money needs to come with policies and access measures that will mean that people in low and middle income countries should also get those medicines and diagnostics, and, you know, being based on public health needs and not just who can pay the most money. Because if that's the case, then we know who will win. So that's probably a topic for another day, but it's something that affects people in all of the countries that are represented on this call, I think.
Thanks so much. Diana, I wanted to get your attention turned, as well as Jess and Lillian, to some of the Q&A that Roger's been handling a little bit on his own. We've had a number of questions from the attendees here. So I didn't want to put you on the spot with a specific one of these questions, but maybe if there is something that you would want to respond to from that Q&A, in addition to kind of telling us what keeps you up at night regarding the supply chain challenges.
Right, absolutely. Actually, while we were sitting here, I realized that there was a huge number of questions coming in with the Q&A. So, and the last two, I think at this point, get at, I think, some of my biases maybe about what we should be doing in order to, or what the lessons that we should be learning from this particular incident, from the COVID pandemic. I think, you know, everything that everyone has said about PPE, about shortages, about a lack of ability to move, about a lack of equity within the system, all of those things to keep me up at night. I think in the first month of the COVID epidemic, I cried probably 4 or 5 times at work, because I was just so frustrated at an inability to find the things that we needed in order to move product forward to specifically Africa. You know, that those shortages are they are reflective at this point of a lack of investment by those manufacturers in sub-Saharan Africa. We don't really have a whole lot of choice in Africa in terms of where to source generic drugs. There are a few places, certainly South Africa and Uganda and a few other smaller manufacturing sites, but certainly not with enough capacity to provide for the entire continent. And I would say that in large part, we specifically, you know, the donors have somewhat done this to ourselves and to the continent, because we've focused on what we call best value, which is, you know, cheapest price as well as higher quality, right? So we want them to be FDA or WHO pre-qualified. And in this case, you know, that works for a period of time, but we are now at an inflection point, I think, for Africa, where it is no longer acceptable for all of the product to be coming from outside, and for, you know, for the donors to be buying and shipping to countries without really thinking about how a sustainable private sector should be operating, and how, you know, that sort of investment, that upfront investment in manufacturing should play out. And so I welcome additional conversations about this, because we have been thinking about it now for some period of time, honestly, before COVID struck. Our supply chain was creating a strategy around how to convince and incentivize manufacturers to create, some of the manufacturers of generics, to create manufacturing facilities in Africa, and to manage those facilities and to manage that product so that it is supporting needs in Africa. We've only gone, you know, a tiny bit in the positive direction, but I think that this is something that is clearly needed in the medium to long term. So again, I welcome additional conversations about this.
Thanks very much, Diana. I want to turn over to Roger for any closing comments to some of the questions that he's answered, and then to Lillian for some final words. Roger?
Thanks for this conversation and discussion. Very, very helpful. I just hope my answers actually answer your questions. But again, a lot of information is available on the public domain. So if we are available, you can drop us an email, you can contact us, ask for the information. This has been very, very helpful conversation. Thank you so much. Over.
Thanks, Roger. Lillian, any closing remarks?
Yeah, thank you very much. Just to say that if there's anything that we haven't learned from COVID-19, at least one thing is that we need now to move to implementation of DSDM and make sure that recipients of care are taking charge of their health and their lives, and recognizing that they can and are able to make important and informed decisions in their lives. And therefore, it is important now that people are starting, those who are in that category are able to receive ARVs for a period of time. But I think also to close by saying that let it be now that we are able to really implement the integration of services, so that we are looking at an individual as a whole and providing all the services to people, especially if they have one-on-one different service providers providing services and leaving others behind. But I also want to end by saying that we now must get back to making sure that engagement of communities, engagement of people living with HIV cannot be ignored anymore, because we have seen that they've been a key important factor in the delivery of services for these months that most countries have been under lockdown. Thank you.
So I just want to say a quick thank you to Roger, to Jessica, to Lillian and Diana for their insightful both presentations, engagement ahead of the webinar, and answers to the questions today. I also want to thank you for persisting with some of the intermittent connection issues, and just reiterate what Lillian was saying around ensuring that recipients of care are at the center of the response along with communities, and that one of the COVID lessons has been the value of some of these differentiated service delivery models when they are done with the recipients of care at the center. We hope to stay engaged with the supply chain community, and will continue to use the resources that you produce and check for your updates, as we are all obviously committed to ensuring that there isn't any interruptions in treatment care and support during the epidemic. Thanks to everyone for joining the webinar today, and we hope to see you all next week for the next iteration. Thanks very much.